Talk with Maria. Healthcare isn't just about medicine, it's about compassion, community, and the people behind the care. Today, we're joined by a leader in nursing, in the educational perspective of nursing, a dedicated practitioner and an advocate for healthcare equity. Please welcome with me today, Dr. Catherine Alicia Georges. Dr. Georges, thank you so much for being on the Talk with Maria show.
Thank you for having me, Dr. Maria.
Yes, thank you so much. So, my goodness, when we talk about home care, healthcare, nursing, tell us where you evolved.
Well, after graduation from college, I went to Seton Hall University in New Jersey.
Nice.
I always felt engaged when I did my community health nursing practice in Jersey City, New Jersey. And so I opted to become a visiting nurse.
Wow.
And so I worked for the Visiting Nurse Service of New York for 10 years.
Visiting Nurse Association.
Right.
Wow.
And so I felt I was connected with that. During my time, because I've been around a long time in nursing, it was before Medicare just started when I started with Visiting Nurse Service of New York. And it's during that time when you begun to see not just the need, but the reason why people wanted to stay at home.
Wow.
And as I say now, as years later, nobody wants to be in a nursing home.
Yes.
People want to age at home
That's
gracefully.
correct. Yes.
And
They want to be in their environment.
Yes.
They want to see their little teacups.
Right.
Their break front that we never use, that china.
Yes.
It's
I agree with you. But you also saw, and I always say to my students, undergraduate and graduate and doctoral students, you don't know people when they're in your institution because that's an artificial setting. You know them when you walk in the door to their home and you are their guest.
Yes, that's correct.
And there's a different
atmosphere.
completely.
Yes.
And you see people and you see their interaction with family, you see their interaction with the environment so that you understand what you're seeing when they come into your acute care settings.
You make my heart so happy when you say that. As a discharge planner, a social worker and I once decided that we were going to take as many people. We had a goal, 100 people out of the nursing home. And we worked so hard, and to each client that we discharged, and I would go to their homes to evaluate their homes prior to getting them out and putting that whole plan of care together, you realize how much homes meant to people, how much their beds, how much their chair. If they've had it for 50 years, if they had their champagne bottle from the day they got married, if they had a little purse that their great-grandparents left, they knew where everything was. And they wanted to come back home. Right. And home meant so much to them. Yes. And we achieved that 100 goal.
Wow.
We did. And it's fascinating to see inside of people's home and what you think is, there's a value and there's a care and there's a compassion and there's a joy that brings people, and they live longer.
Right. Well, you set the pace because that's now the new trend again.
Yes.
People are now saying we need to bring people back into their communities.
Yes.
Plus, years ago, Visiting Nurse Service of New York did a study. It costs less.
It does.
It costs less, and I'm sure you and your colleagues found that it costs less, to maintain a person at home. We're aging gracefully in this country, and we have to age with dignity. Absolutely. And that's what I think we find when people are in their own environment.
Yes.
Because when they're in a nursing home, that is not their environment. No. So aging with dignity, aging in place, making sure communities have the resources to be able for people to be maintained in those communities, I think is critical.
I think so too. So now you moved away from 10 years of being with VNS. What was your next move?
I went straight into academia. There was this woman who was my mentor, and she's still to this day, even though she died in January, my shero. She died a year ago, January, Dr. Claire Fagan, who at one time was president of the University of Pennsylvania. She founded a program at Lehman College. And because it was a revolutionary program where nurses learned physical assessment and could do primary care when they graduated, she I say to people, she called me all the time, you need to leave VNS. I said, you guys don't pay enough money in academia. I'm making great money at VNS. And she finally convinced me to come to Lehman. I went to Lehman and I stayed there for 48 years. I loved it. I went from lecturer, after I got my master's when she had already recruited me from NYU. And then I said, I became a lecturer and I worked through getting RNs back to get their bachelor's degrees at Lehman, and did a lot of other work, with hospitals and doing on-site programs for their nurses on site. And yes, and then I went ahead and I knew I had to get a doctorate till I could move into the ranks of the professoriate, the assistant. So I went assistant, associate, and full professor when a number of years before I retired.
Congratulations.
Yeah.
That's a lot of study, a lot of
Yeah,
money.
it was a lot of work. But you know what? It wasn't just the work, it was what it meant to me, but not also what it meant to students who saw me as a role model, and that if I could do it, so they could do it. So they could finish their masters, they could finish, and I had the opportunity at Lehman, which was really critical for me, to start a number of programs.
Wow.
Like the family nurse practitioner program, the doctorate in nursing practice, making sure that we participated in the PhD program at the Graduate Center CUNY. But that was important to me. And to see.
You made history.
Yes.
And you know what? I love Lehman College, and I'm so happy to be sitting here with you, because that's where I did television directing and producing. And I would have my sons come in, they would be doing their homework, and I would say, I would look at that teleprompter, one day I will be on television. And here I am, spending 48 years.
48 years.
My God, you saw all the campuses built,
I
all
sure
the trees
did. Well,
grew.
one of my biggest things was we opened a year ago on February 1st, the $95 million nursing center for education, research, and practice. I worked 20 years to get that done.
Kudos to our wonderful Lehman College. Wow, we have to take a break. We'll be right back with Dr. Alicia Georges. Stay tuned. Welcome back to Talk with Maria. Today we're joined by a leader in the nursing education, an advocate for healthcare equity, Dr. Catherine Alicia Georges. Dr. Georges, tell me, 48 years at Lehman. The first year you got there, did you think 48 would fly this fast?
No, I didn't. I just said, I'm gonna just hang around here for a little while. I'll go back to visiting nurse service.
Right, you love that visiting nurse.
I love being in community. Yes. But because when I went to Lehman, I was still involved in community.
Yes,
and
community lives in you.
And also had an opportunity to also spend time working in places like that have since closed, Fordham Hospital, that that closed. So I had students there. But then I went to Lincoln Hospital in the Bronx.
Seriously.
And my students and I worked out of the emergency room. And if nothing else, it really cemented in my DNA the need for us to understand what resources or lack of resources existed in communities.
Let me tell you something. I volunteered. I wanted to get into nursing so badly that I volunteered at Lincoln Hospital.
Oh, yeah.
And that 149th Street and 3rd Avenue Hospital is no joke.
Yes.
You see every single thing that can happen to a human body in there.
Right.
I mean, like, oh my goodness.
I know.
How did you survive training there?
Well, first of all, because the staff were so great.
Right.
And the nursing staff at that institution were top-notch.
Yes.
They did
have to know nursing to be in that
and they cared about the patients.
Yes, definitely.
And one of the other things that, they most of them spoke Spanish.
Yes.
Which is so
critical.
critical.
It's a multilingual corner.
Yes, and so it was, and I had a couple of my students who did too, but it was a welcoming environment.
Definitely.
And even though it was under-resourced,
right.
They managed to do what needed to be done.
Wow.
And so they try to save lives.
And of course, being students under your watch, they must have been just, oh my God, excelling.
Right, they did, and some of them went back and worked there for a number of years.
Yes.
And to this day still talk about.
And it is a
what
city
it was.
hospital.
It is.
Yes.
It was part of the Health and Hospital Corporation.
Health and Hospital Corporations.
And they've done, and right now they're doing quite well.
Yes.
With its leader that they have now, the CEO, Cristina Contreras.
Wow, Cristina Contreras. Is
Yes, I like to say her name because she's a graduate of Lehman College Social Work Department.
Yes. Oh my goodness. Wow, we have to get her on our show.
Yeah, you need to. You should bring her
definitely.
in. You should bring her
Cristina.
in.
And that woman power, let me tell you something, it's no joke.
Yeah, she's a good
leader.
Yes, she's the CEO. So
yes.
It was the days when the young lords, took over. When I went, before I went to VNS, before I went to Lehman, when the young lords had taken over and brought to the public's eye the lack of resources. And I think knowing that, we really didn't mind working in those institutions because we knew we were bringing something that was there. And just having the number of students and any given day in those things, they've always been understaffed. People saying, oh, it's a shortage now. There's always been understaffing.
And again, nurses get burnt out. They work and people have to understand the critical end of watching another human being go through all that trauma just mentally and emotionally burns you out. And nurses do play a part. They fall out after a while. They're like, I can't do this anymore. What about the underserved communities? How do you address that area?
Well, one of the big is through policy changes.
Yes.
I hate to say this, but we talk about the Bronx having the worst health indices in the state of New York.
Yes.
Well, why is it? Why do we continue to have that? Because I don't think we get our fair share.
Right.
And also because we don't get our fair share, we can't entice people to come and provide services that's needed for those communities. So we've got to do something about making sure we have proper housing.
Yes.
Housing
is critical.
Right.
I know Bronx Hospital.
Bronx Care now.
Bronx Care
it used
now.
to be Bronx Lab.
Yes, Bronx Lab, the old Bronx Lab.
Yep,
Boy, oh boy.
yes.
They have a housing setup that whole housing scheme for their nurses and doctors.
Right, they
which
do.
I thought was excellent.
Right, but they never have enough.
They never have enough.
So, but one of the things that Montefiore used to have
Montefiore
years ago,
as well.
when we graduated, some of my classmates from Seton Hall went there and they all lived in housing, over there. But we now have to do something to entice the providers, the nurses. The physicians is fine because they get the graduate medical education dollars. So they're there in any of those hospitals that help them later on to pay for the education. That doesn't happen with nursing.
I know Stony Brook has a few grants that they give to some of their nurses.
Right, they do. They do. I mean, the Stony Brook is a public institution.
Yes.
It's part of SUNY, and so is the institution.
Yes.
But again, it's what we are going to demand from our state.
Yes.
That needs to filter down to our local community.
And maybe a wonderful leaders now would make some dollars available and some care and grants available for us to be able to care and to have nurses, feel, because it's always a great profession to get into.
Right, it is. And I know New York State did get some monies for workforce development.
Yes.
And so they're working on that. But in the interim, we've got to do something to keep the nurses who are there. And you're right, people get burned out. They get compassion fatigue.
Compassion fatigue.
Yes,
That's
it's just like, I don't know if I can do this tomorrow.
Yes.
So what do we do for them in those environments?
Oh,
so
boy.
our CEOs and our chief nursing officers and our managers
should have a big summit.
Right, should figure out how to keep the folks.
Yes.
And people don't need toxic bosses. They don't need environments that they don't feel comfortable in. But it has to be bottom up and top down, so we meet in the middle.
I love the fact that you agree that we have to meet in the middle, because a lot of times in the profession, there's so much top-heavy situations floating. So meeting in the middle is always a great idea, and hopefully we can change this in this era before the robots step in.
I know. Yes.
We have to take a break. We'll be right back with Dr. Catherine Alicia Georges. Welcome back to Talk with Maria. Today we're joined by a leader in the nursing education and advocate for healthcare equity, Dr. Catherine Alicia Georges. 48 years is no chicken scratch. You have seen everything. The sun go up and down at Lehman College, the snows, the trees, the enhanced opportunity of nurses coming in. Your heart is just nursing. Was nursing your primary when you thought about, oh my God, what I want to be when I grow up?
I always wanted to be a nurse. I come from the U.S. Virgin Islands, and so I saw the role that nurses had in that community. They were leaders. Yes. People respected them. Yes. My godmother was the nurse midwife. Wow. She delivered me.
Wow.
She delivered all of us.
Yes.
She delivered half the island and most of my friends.
Wow.
And it just seemed that was such a notable profession. And my father, who was, he wasn't a postmaster at the time, but he worked at the U.S. Postal Service. He kept saying, okay, fine, you want to be a nurse, then you going to go to a school where you can get a bachelor's degree. Wow. So that's how, and so he guided, and so did my godmother guide, and that's what we needed to do.
Are you one of how many?
6.
Very nice.
One of 6, and so I went, nobody else wanted to be a nurse.
Right.
I went into nursing, and I've not regretted it.
I felt
I've been good to nursing, but nursing's been good to me. I've had the opportunity to have the breadth and the depth of all, because nursing is human caring.
Yes, definitely.
And so just understanding what's going on and being able to move in different spaces when necessary was so critical for me. And I think nursing gave me that opportunity. I wasn't boxed into a silo. I had an opportunity, and particularly in community health.
Yes, I love that part.
Which is such a broad area.
Yes.
You had the opportunity to shine.
To meet different diversity of people.
To influence policy, to influence those who were in elected offices, in appointed offices. You had the opportunity and to raise your voice in those settings.
Very sweet. I love that. I thank you for taking nursing to this direction, because at the end of the whole plan, you must have a nurse. A doctor needs a nurse. Mm-hmm. A human being needs a nurse. Mm-hmm. A hospital needs a nurse. Home care need nurses. Mm-hmm. And it is so vital. Where do you see patient care and caregiving in today's world with all those, the robotics coming in? I'm very concerned about that, Dr. Georges.
Well, I am more concerned about AI. And that it's, I'm just finishing up a study on how Black nurses, have the insights they may have on the use of AI in those communities where they work. And will it mitigate some of the issues and inequities that are occurring right now in society? So the thing that nurses says is, you cannot replace our human caring through AI or a robot.
Right.
None of them can do that. We still have the touch. We still have a robot, and AI cannot transmit the caring, the human caring that exists in nursing.
Yes.
The compassion, as you talked about. No.
The care, the smile, the compassion.
None.
Just doesn't wither. So I know that you've also gone around the world bringing student nurses in to the United Nations, to the U.S. Soil. Tell us a little bit about that.
Well, years ago, we started a program in Korea, because the nurses there wanted to come and get another perspective. So they came to the U.S., came to Lehman, went to our bachelor's programs. From our bachelor program, many of them went into our master's, our family nurse practitioner programs.
Wow. Some
went back, some stayed. Others went to all different parts of the United States. Sweet. And, to this day, I hear from them. I see them. They have
progress.
Been, right. And going to Korea placed me in, I had been to Nigeria, where I worked back in, when it was Biafra, and before, just after the Biafran War. After the Biafran War. It was after, and worked there for a few months. But this gave me the opportunity also to see and
Different
understand,
perspective, yes.
that it's our needs are the same worldwide.
Yes.
And the human caring exists, whether we're in Asia, we're in Africa, or the United States.
Yes.
That's what we should be about. That's what nursing is, and that's what we should all be about.
I totally agree with you. When you started nursing, what was the wage like?
$6,072, and VNS is one of the highest paid groups.
You're kidding.
No. And now, the going rate in New York is again, it depends on where you are. It's not in all the institutions, but in the large settings, it's over 100,000 to start. But then again, rent is sky high.
Yes.
Food is sky high. So
Concerts,
when you
yes.
compare that,
Yes.
it's not really,
is
even
meant-
for that, if you
yes.
have a family, it's not a whole lot.
Yes.
When you consider what it
And
is.
I think that's one of the reasons why nurses don't altogether, people that want to become nurses don't see that factor as a great earning piece. Even the home health aides, we work very hard to make sure that home health aides have their piece of the care money that they should get. And a lot of them come in and they would rather go and, like I say, smell the French fries at McDonald's.
Yes, right.
Yes.
Because, home health aides are so crucial and critical
Yes.
to our maintenance of people in the community.
Oh, definitely. They're the eyes and
Right.
ears.
And, the nurse, nursing is fine. Nursing can go in to supervise the medical piece. But here are the people who are here doing the things that those folks need. Because people have the kind of care that we can teach them. We teach them to monitor the medications, to do clean dressings, to do some of the other things that family members who may have to work because they have to take care of these folks. Yes. So they're working. So we need the people who can do it.
Yes.
And those
We
men and
need
women.
the people that can do it.
Right. And we have those men and women who want to do it.
Yes.
But you gotta pay them a decent wage.
Yes.
They have to have a wage where they can support their families.
Yes.
And don't have to work 2 and 3 jobs.
And at the end of the day, you can't quite care for someone if you're doing 3 jobs, 2 nights, 3 days, and you're still running. It's a very hard factor for them to work around.
Right.
We wish that the wage would go up. Of course, everything takes time and place.
But you see, we have to have the funders like Medicaid,
Yes.
who must understand that they have to provide that.
Yes.
Because we're keeping people in community. They're not in nursing homes.
Yes.
Where we cost them more.
Yes.
Pay the
Yes,
folks
the
who caring
Casa.
for them.
Remember Casa in the Bronx?
Oh, please, and knew them very well, knew the Casa people. I love them.
Well, this is a wonderful conversation with Dr. Catherine Alicia George. We have to take a break. We'll be right back with Dr. Catherine Alicia George. Welcome back to Talk with Maria. Today we're joined by a leader in nursing education and advocate for healthcare equity, Dr. Catherine Alicia Georges. What are you doing now? What's your plans?
Well, right now, as one of my friends call it, it's preferment, not retirement. So I prefer to do a whole lot of things. So now I'm working with a historically black school of medicine, running a community health workers project. I still have a year. We're almost done with that project now. And still being involved in working on boards, Easter Seals, I'm on the national board, and some other organization working with Black Nurses Foundation, which was located in Atlanta, Georgia. And so we're doing a number of things. And so I continue to advocate. I'm going to be a disruptor. I call myself international disruptor. So
Listen to those words carefully.
Disruption,
Yes.
but good disruption, because
Yes.
that's challenges.
Yes.
And
Absolutely.
and because I'm committed to what happens as I'm aging, I want to be sure that we have what's needed.
That's so
for
sweet.
people who want to age.
Yes.
At home.
The legacy of aging is very important. Where do you think at the end of 2025, let's just say, where do you think nursing is heading?
We've got to stop the burnout.
Yes.
And we've got to go out there and recruit some more folks into the profession, because we're aging in nursing. And so we're not, even though there may be almost 4 million nurses in America, we're not young anymore. So we've got to bring in a whole new group of people, but we've got to bring them in to understand that it is human caring. And the key here is that the public trusts us.
Yes,
For over
definitely.
20 years, we're the #1 trusted profession. And what our healthcare facilities need to understand is we need to make sure we retain those trusted, folks in the profession. I heard a minister say the other day and said to us that we're the hope healers. We're the people who bring hope, to communities. And I think if we insist on that, push for that, let's use nursing in the breadth and to the top of their profession, that we can provide more services. And we got to get people out of hospitals.
Yes.
We got to get nurses more in depth into the community. We've got a lot of those, hospital at home nurses have moved into there. They're the nurse practitioners. They're the geriatric nurse practitioners. We've got them doing the nurse midwives doing the deliveries, and we got. That's where we need to go. We need something. We need to have a much broader and forward look in nursing. So by the end of 25, we should have. I don't want to go there and start a revolution, but why not?
I'll be
I'm
right
a
there with
disruptor,
you. Yes.
but we need to do something.
Absolutely. We also want to thank VNS and Lehman College for allowing the space that you have grown in. And VNS is still thriving. I know a lot of nurses that are working with VNS. I worked with Partners in Care. And
yes.
And they're wonderful throughout the HIV pandemic. I was one of the aides that ran around and cared for everyone that needed care. And so I understand so well what you're talking about and the joy that it brings when you can work in the community and make someone happy even as they're in their senior years. I love you.
Great.
I thank you so much
You
for
have been
everything that
such
you
a
brought.
wonderful, and I admire you for all that you've done and
Thank you.
continue to do.
Yes. Thank you for joining us in the Talk with Maria today. I hope you found our conversations informative and inspiring. Visit our website, talkwithmaria.com, for resources and information. Share your thoughts on social media using #TalkWithMaria. Until next time, stay healthy.
Talk with Maria is made possible by. If you're passionate about helping others, become a certified home health aide with Home Health Aid Training Institute, 516-333-3689, or visit hhati.com. Experience the authentic taste of Italy in the heart of Westbury, Rialto Restaurant. Make your reservation at 516-997-5689. Brooklyn Boulevard Home Care. They care for you in the comfort of your own home. To schedule your care, call 718-683-8303.